So with this, I introduce Hayley. So Hayley is a registered physiotherapist with a special interest in pelvic health and women's health. She completed both her honors Bachelor of Science and Masters of Physical Therapy at the University of Toronto, and currently works at Myo Detox in Yorkville, Toronto. Hayley has experience working with chronic pain patients at Women's College Hospital, and she sits on the executive board of the Women's Health Division of the Canadian Physiotherapy Association. Her mission is to raise awareness and knowledge of pelvic health and empower those living in silence with pelvic floor issues to find their voice. I personally know she's very passionate about this area, and she's taken her time out as a full volunteer basis to put all this together for us. So with that, we're very happy to have you with us, Hayley, and over to you.
Thank you. That's such a great warm introduction. Thanks so much. Okay, so I'm going to start sharing. Hope everyone can see this. Okay, so bladder and the pelvic floor.
Hold on, Hayley, your voice is,
So today I'm going to be talking and pelvic floor conditions as well,
okay,
and how they're related. So a little bit about me. As Faraz just introduced me, I'm a registered physiotherapist. My name is Hayley. I do have a focus in pelvic health and women's health, and I have some experience working at Women's College Hospital in the TAPME clinic, breast cancer clinic, osteoporosis, rheumatology clinic. Worked at Toronto General for a short period of time in the nephrology and hemodialysis units. I did some pelvic health at LifeMark, and I have done all my advanced courses in pelvic health. And I'm currently working with the Women's Health Division, and I'm staying on for another year now. So that'll be 3 years in term. So today we're going to start off by talking about the pelvic floor. What is the pelvic floor? Just a brief overview. And then we're going to go over the urinary bladder and the pelvic organs, common conditions involving the pelvic floor, urinary tract infections, and pelvic floor dysfunction. And then we're going to jump into some treatment on pelvic health physiotherapy and what it can offer you in terms of bladder and the pelvic floor. And then talk about some supplements that we recommend in clinic as well. So the pelvic floor. What is the pelvic floor? Pelvic floor is a bowl of muscles within the pelvis, and they start at the front of your pubic bone and then they extend all the way back. They wrap around to your sacrum and tailbone at the back. And they are involved and a part of the inner core, which includes the diaphragm, the multifidus, which is our back muscles, the transversus abdominis, which is like a little corset muscle that wraps around our spine and our abdomen, and the pelvic floor as well. So that's the inner core. And the pelvic floor has 4 main functions. It does do more than this, but these are the main ones. So sex, bowel and bladder, which we'll be talking about today, core stabilization, as it is a part of the inner core unit, and it works with the lymphatic system as a sump pump, so to pump lymphatic fluid throughout the body.
Hi, Hayley. Just to stop you there, could you put your presentation on slideshow? So if you see at the top left corner, you slide.
Oh, yeah.
Yeah. Okay. Perfect. Thank you so much.
Is that better?
Yeah, it's much better.
That was, okay, great. Sorry about that. Okay, so pelvic organs. So the pelvic floor actually works as a sort of like a little sling, a support sling, to support organs within the pelvis. And this includes the urinary bladder, the rectum, and the uterus. So if I can direct you to the top image here is of a male, and you can see that the bladder is in the front, and the urethra kind of comes out there through the penis, and you have the prostate that wraps around the urethra. So some dysfunction can occur as well with different prostate conditions, and that's why. And then you have the rectum. Okay, and then for women, of course, there's the uterus, which is the reproductive organ, and it has a role in pregnancy and menses. So the urinary bladder, it has a muscle called the detrusor muscle. And this muscle remains relaxed to allow the bladder to fill up with urine, and it contracts when it wants to release this urine. So it relies on a smooth coordination between storage and voiding that uses neural pathways in the central nervous system. It's really important to note that this is controlled by the central nervous system neural pathways because it has some function for what I'm going to talk about later on. And as well as the central nervous system involvement, the bladder and the rectum both have voluntary control with the sphincters, so we can turn them off and on to control this voiding or defecation, which is why the bladder is so interesting. So it is controlled involuntarily and also voluntarily. And so these external sphincters are actually controlled by the pelvic floor muscles. So this is where the pelvic floor muscles get involved now. And you can see it in the diagram. There's that sphincter there, and the pelvic floor muscles wrap right around it. So pelvic floor dysfunction and the bladder. So there's a few different conditions that pelvic health treats. These are just some of them. So dysfunctional voiding, overactive bladder syndrome, urgency and frequency, urge incontinence, and interstitial cystitis, which is also known as painful bladder syndrome. So to start, dysfunctional voiding. Dysfunctional voiding is different from detrusor sphincter dyssynergia. So dysfunctional voiding involves dysfunction of the external sphincter during voiding in patients that are neurologically intact, where both the detrusor and the external sphincters are here. You can see that there is normal voiding where there's low pressure and the sphincter is opened up, allowing urine to pass from the bladder. And then to the right of it, the dysfunctional voiding, where you have really high pressure with the detrusor muscle contracting, and you're also contracting the sphincter at the same time. That would make it very difficult for voiding. And again, this is in neurologically intact patients where the dyssynergia occurs with neurological dysfunction. And it's the same issue, but it's just a different cause. Overactive bladder syndrome. You might have heard this one. It's very common. So overactive contraction of the detrusor muscle occurs during the storage phase of bladder function. So the actual voiding phase itself is not involved here. It's only during storage where the bladder keeps contracting over and over again. And this isn't due to infection, so there should be no presence of infection, but you will have those symptoms of urgency, urge incontinence, so leakage with that urgency, and frequency as well. So needing to go to the bathroom more than 8 times per day. So I thought this article about overactive bladder syndrome was really great and sort of the role of pelvic floor muscle training and bladder training in overactive bladder syndrome. So it goes to show that the literature on comparative effectiveness indicates that bladder training is either equivalent to or more effective than medications for reducing overactive bladder symptoms. And bladder training includes lifestyle modifications, use of relaxation and distraction techniques, which we'll talk about later, for control of this urinary frequency and urgency. And pelvic floor muscle training also reduces detrusor activity and improves quality of life in overactive bladder patients. So I believe that was a part of the literature review that they did. That was one study. It's not conclusive that it reduces detrusor activity, but overall that has been the general sort of thing that we see in clinic and the results that we get. So experientially, yes, it does reduce that detrusor activity, and the quality of life piece is really important because this can have a huge effect if you have to go to the bathroom all the time on your work and your life. So pelvic floor muscle training has been proven to be very effective in that. And so the study concluded that the first line of conservative treatment can include bladder training or pelvic floor muscle training or a combination of both. So urgency and frequency. Urgency is the sudden, strong, overwhelming urge to urinate. And the frequency is feeling the need to go to the bathroom more than 8 times during the day. And nocturia is when this frequency occurs at nighttime. So it's waking you up to go to the bathroom in the middle of the night. urge urinary incontinence. So this is leakage that occurs in conjunction with the urgency, and this can be accompanied by the stress urinary incontinence, in which case it would be termed as mixed because you have both. Okay, interstitial cystitis, painful bladder syndrome. So this is one that can commonly present like a urinary tract infection. So you can have that chronic pain and pressure near the bladder with lower urinary tract symptoms, and this has to last more than 6 months for it to be interstitial cystitis. And like I said, it resembles that of a chronic UTI, but you won't have any infection present. And this is only diagnosed through cystoscopy. So if you've seen a urologist and they told you you had interstitial cystitis, but you had not had a cystoscopy done, then it cannot be confirmed that you have this diagnosis. So UTIs and pelvic floor dysfunction. Similar presentation, different etiology, so they are caused by different things. The treatment is different, but they are often related and the treatment can overlap. So urinary tract infections, you have that frequency with going to the bathroom, you have that urgency, that burning with going to the bathroom, and you can have a fever as well as abdominal and low back pain. And with pelvic floor dysfunction, very similar symptoms. So you can have that frequency with going to the bathroom, that urgency. You can also even have bladder pain with voiding and low back pain as well. And what's a little bit different is the pain during intercourse. So you might see that a little more with pelvic floor dysfunction. So in order to have a recurring UTI, it is classified as 2 or more UTIs within 6 months or 3 UTIs within 1 year. And the risk factors for recurring UTIs include pelvic organ prolapse, voiding dysfunction, and menopause. So these are all pelvic health related conditions. So they are risk factors for UTIs, which I find very interesting. And sort of the line of thinking is if the pelvic floor muscles are hypertonic, tight, weak, overactive, they can spasm or have difficulty relaxing when you're going to the bathroom. So that residual urine in the urethra and the bladder can contribute to infection. So you might experience difficulty starting a stream of urine, difficulty stopping the stream, or feeling like you haven't completely emptied after going to the bathroom. So now I'm just going to touch on the treatment aspect, and of course, pelvic health physiotherapy treatment for these pelvic floor dysfunctions and lower urinary tract dysfunctions. So I'm going to talk about bladder diary, fluid intake, voiding habits, urge delay, pelvic floor muscle training, myofascial release and manual therapy, mindfulness and meditation, and vulvar care, and also on supplements as well. So these are all things that fall under the umbrella of pelvic health physio. So with the bladder diary, filling out a bladder diary can help you to visualize how often you're going to the bathroom, how much you are voiding each time. I put milliliters here, but we typically don't measure when we go to the bathroom. So we usually ask you to count in seconds how long you were urinating for, and whether there's any urgency associated with the voiding, and if you experience any leakage with this urgency as well. So that urgency incontinence. You can also document how you feel during and after voiding, whether there was any pain or burning in the area, and if you feel that you were able to completely empty. Fluid intake. This is always a point of contention with clients. They don't want to give up their coffee, but coffee is a bladder irritant. Caffeine is, and so that involves tea as well. And any carbonated drinks, also bladder irritants, and juice as well. So pop, juice, caffeine. For volume, do not restrict your fluid intake. It seems to be sort of the easy way of thinking that, you know, the more I drink, the more my bladder is going to be full and the more urgency I'll have. But fluid volume does not correlate with the overactivity of the bladder. This is different, as we talked about earlier. So don't restrict your fluid intake. In fact, you usually need to increase your water intake. in order to improve hydration and improve your digestion and to practice those urge delay techniques as well that we'll get into. So voiding habits. Avoid going just because. So going just because is often something that is a learned behavior, and especially in childhood and growing up, we learn to hold our pee as well. So these learned behaviors can actually contribute to pelvic floor dysfunction and bladder dysfunction because we're making voiding voluntary and we're taking total control over those voluntary sphincters and overusing them, and then we're losing that connection between our bladder and when we actually have a full bladder and when we actually need to go, because we are deciding when to go. So if you're near a bathroom, don't avoid going just because you're near the bathroom. Pay attention to any triggers that might lead to this strong feeling of urgency, and that might lead to leakage as well. And create a schedule. So not a strict schedule because we don't want you going just because it's on the schedule, but a schedule that allows you to have a certain period of time between voiding where you know, okay, it's only been an hour since I last went to the bathroom, so I'm gonna keep waiting for 2 hours to go. And double voiding. So when you feel there is incomplete emptying, you can actually wait for 20 to 30 seconds and see if you can void for a second time. So we call this double voiding in order to completely empty. And optimize your posture. So I put a picture of a squatty potty here. I love the squatty potty. It's a stool that you can put under your feet when you're going to the bathroom. And it's definitely more for bowel movements. So it optimizes your posture so that your anorectal angle is at the optimal position for you to have that bowel movement. And what this does is it allows you to avoid straining. And strain, as you know, can increase intra-abdominal pressure. And it also puts pressure on the bladder as well. So in order to reduce that overactivity, we also want to be optimizing our bowel movements as well and avoid any straining at all. So here are these urge delay techniques. So this is definitely huge with urgency. So retraining your bladder to contract only when the bladder is truly full. This involves positioning, so you can sit, cross your legs when you feel that very strong urgency. Distract yourself, so think about an upcoming event or a really nice memory that you had or your plans for the evening. What are you making for dinner? Do some deep breathing, so practice deep diaphragm breathing, which I'll be going through with you later. Using props like a rolled towel underneath the perineum, so underneath the vulva or your genital area, to apply that pressure and support for the area. And activity, moving and walking to distract yourself can also be a great technique. And then managing triggers, so training yourself to delay the presence of training yourself to delay urge and in the presence of these triggers. Okay, now pelvic floor muscle training. So pelvic floor muscle training is the first line of treatment to restore bladder function in urge, stress, and mixed urinary incontinence, as well as overactive bladder. The core breath is what we use with pelvic floor muscle training, and it involves contracting and relaxing the pelvic floor muscles in coordination with your breath. So combining the pelvic floor muscle contraction and breathing with the urge delay technique is something that we commonly do in order to get you to practice the pelvic floor muscle contractions, reduce that detrusor overactivity, for example, and delay that urge. So an example of this is sitting on a towel roll and performing the core breath. Mindfulness and meditation. So there is a large psychosocial component to lower urinary tract dysfunction and pelvic floor dysfunction. And this involves sensitivity of the central nervous system. So those neural pathways that I spoke about, which control the bladder. And what we need to do often is to activate the parasympathetic nervous system and downtrain the sympathetic nervous system. This can involve diaphragm breathing to activate the vagus nerve, and mindfulness and meditation as well to reduce that chronic stress and the low-grade systemic inflammation that occurs from chronic stress. Myofascial release and manual therapy. So muscles around the pelvis and pelvic organs can become very tight and create strain on the surrounding structures, often sometimes resulting in referring pain to the bladder and other areas. So this is actually has a name. It's called somatic visceral crosstalk. So you can have your unhappy organs telling your muscles in the surrounding area that that they're unhappy, and this causes a lot of tension and pain in these muscles, and it can also work the other way. So releasing tension in the muscle fascia and using other techniques like acupuncture, dry needling, joint mobilizations, and stretching to improve the length tension relationship of the muscles and joints can be very beneficial in treating sort of this somatic visceral relationship and tension that's created. Vulvar care is a really big one. I like to talk about tissue hygiene because it can create problems for in terms of bladder urgency and incontinence and leakage, and also has a huge role in UTIs as well. So tissue hygiene, keeping the tissues hydrated, which means using products that are pH balanced and non preventing any dryness and itching and irritation. Approved and pH wear at night. So try not to wear underwear at night. I say usually don't wear underwear at all, but that's really hard for people. So just try to aim for no underwear at night. And change your underwear often during the day. So if you just worked out, change your underwear after. If you've been wearing your underwear for a long time, just change it twice a day if that helps keep the area clean. If you are going to choose to wear underwear. And a note that I didn't put here, but opt for cotton underwear and underwear that's seamless to avoid any irritation as well. So wiping, always wipe front to back to avoid tracking bacteria into the vulva. This goes for women. So it's really, really important, and it seems really obvious, but it's not, because sometimes we just don't think about it. So make sure that you're always wiping front to back. And just a little note here about menopause. So hormone fluctuations post-menopause can actually alter the pH of the vagina, which reduces naturally occurring good bacteria in the vagina. And this is important for my next point I'm going to make about supplements. So probiotics is something that I often recommend in clinic. If you have recurring UTIs that require the use of antibiotic therapy, these probiotics can be used to help restore the gut microbiome and the vaginal microflora as well. So that good bacteria, that lactobacillus bacteria that's in the vagina that maintains the pH of the vagina. Fiber, so used to optimize those bowel movements. So we talked about how straining can be detrimental for the bladder. So we want to avoid straining and avoid urgency. So optimizing our fiber intake. Utiva has a great UTI supplement as well. So this is something that we recommend in clinic. So it's a cranberry supplement designed to help prevent UTIs, and prevention of UTIs can help prevent pelvic floor dysfunction and vice versa. So they're both very complementary. And the UTI test strips as well from Utiva. So if you're wondering, well, do I have a UTI or is this just pelvic floor dysfunction? So this can actually help you test that at home so you're not guessing, and to take the appropriate treatment routes that you need to take. So now we're going to go through some exercises. I don't know how we are for time, but I think I'm right on time. Okay, so what you will need to do, I'm just going to set up my station here. You'll need a mat, and we're just going to start out with some breathing, and then we're going to do some stretches, and then I'm going to teach you a sequence on how to lengthen your pelvic floor, because this is safe and I don't need an internal portion to be able to do this. So some lengthening exercises, and then we're just going to finish off from there.
Hayley, we have a question, and the question came from Sylvia. She's asking if there's any brands of probiotics that you recommend.
Yeah, so probiotics are really interesting because not the same one doesn't always work for everyone. There's lots of different strains, so it sort of depends on what you're experiencing and your needs. So there's ones for prepartum, postpartum. There's ones for specifically certain conditions. So if you've had to take antibiotics, there's ones that replenish post antibiotic therapy. So a couple that I can post perhaps in the chat later, ones that I like, I believe it's HMF. That's one that I like to prescribe, as well as I like BioK+. So those are my two kind of main ones, because the BioK+ has the drinkable ones. So you can kind of tailor how much or how little you take. So I just find it easier if some people are having issues with the probiotics to kind of regulate how much they take in. So BioK+ and the HMF.
And just to add to what Hayley is saying, just a heads up to all our audience here is Utiva is actually in the process of launching a probiotic as well. I'm not sure if you even knew that, Hayley, but we carefully selected special strains for gut and urinary tract health with a special delayed release capsules. Anyway, stay tuned because we'll keep you posted on when it's available over the next couple of months, 2 to 3 months.
That's awesome. Yeah, that's great. All right. Are there any other questions in the chat?
No, no other questions so far. Please go ahead.
Great. So we're just going to do some breathing. So I'm just going to set up here. We're going to start seated like so. And I'll give everyone a chance to get ready in their position. Okay. So we're going to start with some diaphragm breathing. So like I said, the diaphragm works with the pelvic floor. And how it works is that every time you breathe in, your diaphragm descends and your pelvic floor actually lengthens to accommodate for this diaphragm dropping. So you're breathing in and you're getting that lengthening, and then you're breathing out and your pelvic floor comes back into a slight contraction, and then your diaphragm lifts up as you breathe out. So that's sort of how they work together, and they work with that inner core unit that I talked about. So if everyone can just place their hands on the side of their rib cage, this is just to provide some tactile cueing, some manual feedback as to whether you are breathing into this area and to expand your lungs. So we're going to take a deep breath in, and I want you to pay attention to where your breath is going. Is your breath going into your chest? Are you breathing up here? Are your shoulders elevating? Are you tensing your neck muscles? Or are you breathing into your belly? Is your stomach coming out a lot every time you breathe in? If you notice that you're breathing into your belly or your chest, I want you to try to direct this air into the lower part of your lungs, where your hands are. So every time you breathe in, I want you to push away your hands, expanding the rib cage. And when you breathe out, make sure that this area is the last to fall.
Hayley, 1 second. For those who are asking how they can zoom into Hayley's image, just click on her icon or just on her image, double click on it, and then it will expand right into your screen, and you should be able to see her more clearly.
Perfect. Thank you so much.
No worries. Thanks, Hayley. Go ahead.
All right, so that is essentially diaphragm breathing. And this is something that's actually not easy. It looks super simple, but it's very, very, very difficult, especially when we've been breathing a certain way our whole life and we have this really abnormal breathing pattern, which is actually very common. It's hard to correct something that comes so naturally to you. So it's about training it over time. So I usually say, just take 2 diaphragm breaths every hour. Just put your hands on your rib cage and try to breathe using your diaphragm every hour, just 2 breaths, just to get you remembering it. This is how I can relax. This is how I can breathe. And it's also, like I said, it activates the vagus nerve. So it's a very great exercise for promoting that parasympathetic nervous system. Okay. So once you understand how to diaphragm breathe, you can actually start working in your pelvic floor with this. So like I said, your pelvic floor works with your diaphragm and it lengthens every time you breathe in through your diaphragm. And this is what I'm going to teach you how to do today in a few different exercises. So first, I want you to get the cueing down for the lengthening of the pelvic floor. So lengthening the pelvic floor is the opposite of contracting it. So it's total relaxation. Some cues for women, I like to use the imagery of a flower. So if you pretend or visualize your pelvic floor and your vulva as a flower, and every time you breathe in, the flower is blooming. So your diaphragm is coming down, you're breathing in through your diaphragm, and your pelvic floor is blooming. And then coming back up into resting tone. So I don't want you contracting it, just allowing it to come back up, because we're just working on lengthening. So for men, the cue can be to allow the flow of urine to pass. So you're opening up all those muscles, you're unclenching your bum. So if you're clenching your bum, don't do that. Allow everything to relax. Relax your hip muscles, your back muscles, your inner thigh muscles, and just allow everything, that flower to bloom or that urine to pass if you are a male. So those are the cues for lengthening the pelvic floor. And this, like I said, is very tricky at first. It takes some practice, but once you do, you'll be doing it with every breath in. Okay, so we talked about diaphragm breathing and lengthening the pelvic floor. There's a couple different positions you can do this in. I'm going to show you constructive rest position because it actually is a position that allows lots of circulation to come into the pelvic floor, and it's quite relaxing. So I'm just going to show you that now. And this position is actually just your feet up on a chair as you're lying down. So I'm going to use this chair because it's right here. So ideally, it would be higher than this, but your feet are just up here, resting like this. And then you're lying on the ground. And I hope that you can still see me. I think you can, which is great.
Thank you, Hayley. Nice.
Okay, awesome. So rest your legs up on that chair, and I hope you're already feeling how nice this feels. And like I said, this improves circulation to the pelvic floor and allows you to relax. So when I'm first teaching how to do pelvic floor lengthening and the core breath with contractions, I choose this position because I find it very relaxing. So you can put your hands on the sides of your rib cage and again do that diaphragm breathing, but now try every time you breathe in to lengthen your pelvic floor. And every time you breathe out, make sure that you're counting to 4 as you exhale. And breathe out. 1, 2, 3, 4. Good. So this is called constructive rest, and you can lay here for 10 breaths and do 2 sets of that when you're just starting to learn how to lengthen your pelvic floor. Okay, I'm going to show you a couple more here. This is where my mat comes in. So I feel like a lot of you have probably done yoga before and have done a child's pose, but this exercise is great for sort of moving and visualizing the opening up and the lengthening of the pelvic floor. So you're going to start in 4-point position. And as you sit back Onto your heels, you're going to imagine that your sits bones are growing farther apart, and you're going to take a deep breath in using your diaphragm, and you're going to imagine your pelvic floor lengthening so that flower is blooming. And then as you come back up, you're going to breathe out, counting to 4, coming back into tabletop, allowing your pelvic floor to return to neutral resting tone. And then you're going to sit back. You're going to imagine the space between your hips growing wider, your sits bones growing wider, your pelvic floor is lengthening. And you're using your diaphragm to breathe in. And then you're going to breathe out as you come back up, counting to 4. So this child's pose position, I usually do also 10 repetitions, and you can do 2 sets, just like the constructive rest position. And I also want you to remember to allow your stomach to just come along for the ride. It's not contracting, it's not working. Your abdominal muscles are relaxed. You're just breathing. So one more time, a deep breath in as you come back, lengthening the pelvic floor. And breath out, 1, 2, 3, 4, as you come back up. Okay, so that was child's pose. Another one that I really like, I'm not sure, I'm just gonna check how we are for time. I think I have time for one more. One more exercise. This is called Happy Baby. So you're gonna you've probably done this in yoga as well, but you're gonna grab the insides of your feet if possible. You don't all have to do this, but this is a really nice way to just visualize the opening up and lengthening of the pelvic floor, because it brings your pelvis into this very open up position, and your hips are in external rotation, so they're even more open. So you're just lying here and taking a deep breath in, again, visualizing the flower blooming, and then exhale, allowing the pelvic floor to return to resting position. And that is Happy Baby. So again, you can do 10 reps of that exercise, just practicing that lengthening of the pelvic floor. And it's personal preference, or if you even like lying on the floor, perhaps you don't, perhaps that makes you uncomfortable, then you can try the constructive rest and just put a pillow under your legs while you're in bed. I prefer not to do it on something too soft. That's why I like a mat, so I can feel my breathing. Okay.
Hayley, thanks so much for both the presentation and the exercises. You did a great job.
Thank you.
No, thanks. We have a lot of questions. We have a few questions that have come into the group chat. I'm not sure if you can see the questions, or if you would like me to go through them, I can do that as well. There's one,
yeah.
You can see it? There's one that came up just around the breath with child's pose, as you just went through that exercise, so we can tackle that one first.
Mm-hmm.
So they were asking specifically, so what is the breath with child's pose? Inhale on the way down or on the way up?
With the child's pose, you want to inhale on the way down, so on the way back. As you're sitting back on your heels, you're envisioning your sits bones are growing wider apart, your hips are coming wider apart. As you externally rotate those hips, sort of when you come back into that sitting position, and you're lengthening and you're breathing in. And then when you're returning to that 4-point position, you're going to breathe out without contracting your abdominal muscles or bracing your core.
Okay, great. We have a lot of questions on coffee, decaf, but let's come back to those ones. There's another one that came in around, what do you do if you have limited knee range?
Limited knee range, is that for the child's pose?
Let me unmute. I will unmute everybody at this stage, and if you have these questions, feel free to jump right in there.
Yeah, because there's also, if you wanted to practice, if you have limited knee range and you just want to practice the pelvic floor lengthening without lifting your legs up or doing the child's pose.
I was listening to something somebody sent me on the iPad. I better mute it. I know, just a second.
Yeah, so I was saying if you do have limited knee range of motion, what you can do is just take 2 blocks or 2 items, like any household items if you want, just rest them beside your knees so your knees can lay right on top of them, and just lay in a open wide position like this. Allow them to totally yeah, so some questions about coffee here. So I'll address those now. So yeah, coffee has something like over 100 active ingredients other than caffeine, I believe. Don't quote me on that, but it has a lot of active ingredients in it, and so it's a bladder irritant sort of in and of itself, even if it's decaf or caffeinated, I find. And even in decaf coffee, there still is a little bit of caffeine. So there's no completely decaffeinated coffee. I thought you need to void frequently if you have a UTI. So if you have a UTI, that is, yeah, so you have this frequency with urinating and sort of an urgency, and that's because you're kind of flushing out the bacteria every time you pee. So yes, it is important to void when you do have a UTI, but when you don't have a UTI, you can, or even after you've had a UTI, you still have that frequency because those signals are still very overactive, but you don't have infection anymore. So you don't want to keep voiding the same way when you don't have presence of infection. How do you know if it is overactive bladder or interstitial cystitis? So interstitial cystitis is diagnosed with cystoscopy. So only by the urologist can tell you that by doing that test. And overactive bladder, both of them we treat. Overactive bladder has sort of different symptoms as well. So you have that association with the storage phase. You constantly feel like you need to go to the bathroom, whereas interstitial cystitis is that painful bladder syndrome. So you have a lot of pain in your bladder. And alcohol is a bladder irritant as well. Yes, I didn't mention that. I did not mention that, but yes, it is a bladder irritant. I find caffeine is more prominent for that, but it sort of depends on the person, and you sort of have to eliminate all of those bladder irritants in order to truly treat. So in terms of toilet paper, you definitely want to be using toilet paper to wipe, but don't wipe, only wipe front to back. Don't wipe the other way because you could track bacteria from the rectum to the vulva. Burning sensation in the pubic area and inside the thighs. So again, that can be pelvic pain, generalized pelvic pain. That could be that interstitial cystitis symptoms that we talked about. It could even, it could even be other painful syndromes that we treat with pelvic health. So that's very generalized, and it kind of depends on the person. So I'd have to do an assessment to figure out sort of why you have that burning sensation, but definitely pelvic floor related if you don't have an infection. So wet wipes after toilet paper. So if you find that your toilet paper is really drying and you do suffer from vaginal dryness, you can use sort of cleansing wipes that are pH sensitive to wipe the area. in order to fully cleanse if you want to, and to avoid that dryness. But I wouldn't say substitute toilet paper for wet wipes or vice versa.
We'll take a couple more questions. I know we have a lot coming in, but I'm watching the clock as well. It's 1:50. So we'll take the last question on from Judy. But if you could go through the questions before that, Hayley, and then we'll stop at Judy's question.
Okay, perfect. So is Utiva safe during pregnancy? I think Farhad's gonna answer that. I think it is.
It is safe, cranberry safe for pregnancy. I think, Kim, you answered that question, right?
Yes, I did. It is safe.
Perfect.
Great. So perfect. So in terms of like your urethra, like becoming stenotic or very tight, that can sort of depend on a bunch of different factors. So again, you would need to do an assessment. I'd like to know sort of like what the follow-up was from your urologist on that one, because usually that is pelvic floor muscle tightness and not urethral tightness, because that's just the tube. So he might be referring to the pelvic floor muscles with the sphincter. So you frequently get UTIs. My question for that is, are these actual UTIs that you had diagnosed and they found bacteria in the culture, or do you just think that they're UTIs because of the symptoms?
Hi, can you hear me?
Yeah. Hi.
Yes. Hi, sorry, I'm trying to okay. So these are UTIs that I have the symptoms for, and then when the doctors do the urine dip, it goes positive for an infection, but then when they send out for culture, no bacteria or growth in the urine.
In where?
There's no bacteria, but when you do the urine dip, it also shows positive for infection.
Okay, so it is positive for infection, but there's no bacteria?
Yes, that's correct.
Okay, it has to show bacterial cultures.
Okay.
So in order to actually confirm that you have that infection. So I would say that that's probably something else causing that.
Okay, thank you.
Would you recommend to rebalance menopausal pH? Yeah, for sure. So with that note that I talked about post-menopause, that the pH changes. So you definitely want to be monitoring this, any symptoms of vaginal thinning or dryness, and changes to the area, which can demonstrate sort of that the pH might be changing, and sort of reflourishing that vaginal microflora that can help rebalance that pH as well. What do you recommend to balance it? So probiotics can be used for this, and also to take care of the vulvar care that I mentioned. So using those products to maintain hydration and appropriately taking care of the area. There can be other things that your OBGYN might recommend or prescribe to you as well. So there's certain creams that you can use, hormone therapy as well, but it's definitely not my area. What I usually recommend for that is the probiotic as well as the vulvar care.
So with that, that'll be our last question for the afternoon. For all of those who still have questions, you're most welcome to email them over to us, and then we can reach out to Hayley or any one of our other experts, and we'll try and see if we can get that answered for you.
Yeah, so I wrote my email there and my Instagram. Feel free to email me or message me if you do have questions, and get in touch with me. I love answering all of these questions, so feel free to reach out.
No, thank you so much. This has been a great session, and one thing we'll do is we'll send a feedback survey question to all of you after this. For any one of those
Do
who,
what? For fun.
Right.
See? People are
yeah, I'll
having
just
fun.
unmute
You're
everybody.
right. Yeah.
I'll mute everybody. Okay. So what I was saying is we are going to send a feedback form. If you have signed up and we have your email address, then you will get that shortly. But if you signed in through a link that you received, please drop in your email address. You can just send it to Utiva Health. You don't need to send it to everybody in the chat section. And then this way we can follow up with you. But Hayley's kind enough to share her email as well as Instagram. If you need that, you can also get in touch with us for that. Back to you, Hayley. Thanks so much for doing this session. It was very informative. Your presentation was great, and the follow-up with the exercises and your patience with the questions. Thank you so much for taking Sunday afternoon for us, and I'm sure with the feedback, we'll get in touch once again with you.
I was muted. Thank you so much for having me. I really enjoyed this. Thank you for tuning in on your Sunday with me. And I hope you did learn some more stuff about pelvic floor and lower urinary tract dysfunction and some stuff about Utiva as well. So thank you.
Thank you. Thanks, everyone. Bye now.